everyone, my name is Ryan Colin, and I'm going to be doing my case presentation for cognitive behavioral therapy this week for the class Advanced Interventions 1, Social Work 550. Alright, so a little bit of background for my client. My client is a 25-year-old female of Pacific Islander descent. And she has been suffering from general anxiety disorder. This is her 5th session with me. Also, her name is Jessica, last name Doe. And specifically with the anxiety, she's been having a habit disorder, which is nail biting. And she's got some ambivalence about that, because she views it as a coping skill that reduces her anxiety, but also at the same time she finds it disgusting to her because of the lack of sanitation. So the theoretical approach that I'm going to move forward with Jessica is cognitive behavioral therapy, which is mainly used for people who are having cognitive distortions or black and white thinking patterns. It's rooted in the idea that your thoughts flow into your feelings flow into your behavior, and then your behavior goes right back into your thoughts. So it's a kind of a triangle approach. And the specific intervention that I'm going to be using is called rewriting thoughts. So it's actually a practice activity that we got from our professor in this class, and the idea of it is to take a negative thought, feeling, or behavior that you're experiencing. In this particular case, we're going to be dealing with the nail biting from Jessica, and then you write down, and in our video you'll see later, we kind of talk about it, but you write down kind of like how it makes you feel, how limiting is it, and then you kind of think of a replacement behavior, and then do the same steps for that. So the reason that I am choosing this intervention with this theoretical approach, the habit rewriting with the cognitive behavioral therapy, because of our text, Judith Beck's text. And I think page 4 of her text, she gave a table of what the research says cognitive behavioral therapy can be helped for. And one of the items on that list is habit disorders. And Jessica's symptoms display a habit disorder. So the evidence-based practice that I'm going to be using for my intervention is the GAD-7. GAD-7 is a measurement tool specifically for anxiety. It's called the GAD-7 because it stands for the General Anxiety Disorder 7, because there's 7 questions on it. It's a tool that's supposed to be administered every 2 weeks with your clients that are suffering from anxiety, just to measure their progress or regression. So that's the tool that I'm going to be using. And then also by delivering and creating SMART goals with Jessica to find those replacement behaviors with her. So the clip that I have for you guys that you're going to see is Jessica and my 5th meeting, where we're going to kind of talk about a little bit about the past, but then go into the intervention, which is the rewriting behaviors exercise. And you'll see a whiteboard behind us, and we're going to use that to walk through the negative behavior that Jessica's experiencing, and then explore alternatives that might help reduce her anxiety. So that's the clip. If you guys have any questions about it, please let me know afterwards, but I hope you enjoy. Thanks. Worked for you?
Yeah.
But you'd like to find an alternate coping skill if it did exist?
I find it gross, as I said before.
Okay. Well, the first part of this, I have it kind of prepared already on this board behind us. So it's kind of an interactive thing. So I'm going to ask you to grab a pen, which you have, and then I'll kind of guide you through these steps. But basically, the overall goal is to try to kind of think about the behavior that is you're wanting to change, and to think about it more deeply, because as we discussed about 2 weeks ago, the cognitive behavior is like the triangle of your thoughts, your feelings, and your behaviors, and catching the thoughts is the first step of changing those behaviors, right?
Mm-hmm.
So the first thing I want you to do is write down, if you will, what your rigid belief is. Go ahead. All right, so you've written down. Let me swap you spots here just so that we can see. Okay, so if you're having a hard time seeing, basically what you've written is something will go wrong if I don't chew on my nails. That's your rigid belief, right?
Mm-hmm.
Okay, so what kind of demands or do you feel like that belief is putting on you?
Just not feeling in control, I guess.
So a lack of control?
Yeah.
Feeling a lack of control, okay. And maybe you don't have to write all these down, just so we can talk through some of these things, but when you're feeling that the burden of the demands, how does that make you feel?
Anxious, like really, really anxious. Yeah.
So it kind of increases your anxiety, so it kind of perpetuates itself?
Mm-hmm.
Okay. Do you feel a lack of control when you said that feeling puts a demand, a feeling of lack of control, but when you're feeling like your anxiety is going up, do you feel like a lack of control at that point?
Yeah. I think that's why the nail biting works.
Okay.
So I have control over that.
Because that's what you can do, and
Yeah,
that's what's worked in the past, right?
Yeah.
Do you feel like that behavior of your rigid belief is unrealistic at all?
Yeah, just because you can't really have control over everything.
So acknowledging that you don't have control over something going wrong,
Yeah.
you're saying? Okay.
I have a hard time accepting that.
Okay. So really having that in presence in your mind, that you can sit down if you want to. Thanks. So having that in your mind, that you're really don't have control over not feeling bad, but you're having this feeling of a lack of control in your head about biting your nails to help reduce your anxiety. Could you think of a flexible alternative that would not so much replace the biting your nails, but maybe help reduce your anxiety?
I think so. I just need help finding like different ways to kind of help control the anxiety. Just know where to start.
Have you tried other coping skills?
I have, but none of them have really helped me. I always go back to the nail biting.
So maybe a flexible alternative might be to find a coping skill that does help reduce your anxiety, and maybe not even match the level of anxiety that chewing your nails does, but do you feel like, actually, how would that be? If that's the next step, is how would you feel if there was something that did help reduce your anxiety that wasn't biting your nails?
It would make me feel a lot better, just because I mentioned the feeling gross after biting my nails.
Yeah, because of the sanitation you were saying?
Yeah, exactly, yeah.
So if there was an option out there that a coping skill that you were able to learn and develop, then it reduced your anxiety, you'd feel much better about that.
Yeah.
Okay, maybe we can make a goal to create one coping skill a week, and that can be your replacement for the behavior. So every time that you're thinking about that or biting your nails, you can think about for the next week trying one new cognitive behavioral, replacement technique, and I have a list of coping skills here that I'll give you after our appointment, but do you think that would make you feel more control?
Yeah, I think so, yeah.
What would make you feel more in control about that?
That I'm able to choose the one that works for me. So I have control in that way, like choosing the coping strategy that works for me.
So it give you more empowerment,
Yeah.
more control over
Yeah.
that. So that's kind of this whole exercise. So coming back to this, adjust our camera. How did that exercise make you feel?
Is it Colin, right?
Yeah.
I'm sorry.
No, you're fine.
It was helpful to write out what my rigid belief was.
Okay.
I don't know how to explain it, but like I've been holding it for like such a long time that writing it out like in a way kind of helps me get rid of that and out into the air.